So it is now Sunday at like 8:30 p.m. So I'm flying out tomorrow morning to Seattle, to Phoenix, and I'm gonna meet with Dr. Dry for my consultation. So he's gonna take a look at me, I'm gonna ask him a ton of questions and all that fun stuff. So I'm really excited.
All right, so tell me again, tell me your story getting to this point. I know you lost a lot of weight, but sort of how you did it, what'd you do?
Okay, so about 3 years ago now, I had basically tried every single thing out there to lose weight. Nothing ever stuck. My mom had done Weight Watchers before and she's like, why don't you just try it? And I just kind of jumped right into it. And my first week I lost like 8 pounds or something. And I was like actually liking what I was eating. So I was like, okay, like maybe this could work. And yeah, like a year and a half later, I hit my goal weight. And
year and a half, nice.
It ended up working, so it's crazy. It's crazy how it all happened that way. But
so how much are you down?
145. Well, at my lowest, 145. About 140 now.
Yeah, good for you.
Yeah.
So the current weight you are now, main issues for you are what?
Definitely my stomach is number one.
Okay.
And then I would say like my side, like I have a lot on my sides and like my back, and then my chest.
Okay.
Those are probably my top, and then my thighs, but my arms really aren't that bad. I did some decent toning with my arms.
You can't lose that much weight and not have extra skin everywhere.
Yeah.
I mean, that's just sort of the nature of the process. So the plan again here, what we're doing is basically a belt light pack from our body lift going all the way around. So what we would do in the front here is you have your C-section scars here. So we'll start below the C-section scar down here, sort of right kind of where these underwear line is here. So start here, lift up all of the skin, tighten up your stomach muscles underneath, which have been separated out due to pregnancy and weight gain and weight loss, obviously. Tighten up those stomach muscles, pull this skin and fat down as far as we can, and take as much of it off as we can, which is generally everything from about here to just above your belly button.
So all the scars will be gone except for the one you made.
You got it.
Okay.
Yep. The C-section scars would be gone, this scar would be gone, and this skin here would end up down here. So if you're pulling all of this all the way down.
So then these stretch marks will end up down here.
That's correct. Yep. Okay. This stretch mark right here would end up way down there.
Okay.
So all of this would come off. All of the stretch marks down under here would also be completely removed. The incision then, we take the incision, keeps on coming around here, just sort of kind of right where your underwear line is, coming up onto here, and then we take off all of this extra skin that's on the side and pull up on the outside of the thigh. So all of this comes off. So essentially almost everything from about here to here gets completely removed. And this skin here gets sewn to this skin here and comes up like that. Lifts up everything. And then comes all the way around, again where the incision comes up to the top of the buttock area, lifting up, taking up all of this stuff.
I look in the mirror and I still feel fat or overweight because it just looks like that, but I know underneath I have it's like this is all
see that? And that's the
so hard mentally.
And that's one of the great things about sort of the end of this journey or completing this journey is that the mental aspect of it from anybody who's been big, who's lost weight, is that you still feel like you have to hide it.
Yes.
You still feel big because you have this extra skin. You're not, and you've done a phenomenal job getting to where you are. But in order to be able to get to that final step where mentally you can see the benefits and what you've been able to achieve, we need to take off that extra skin to see sort of what you have so you don't have to hide anything anymore. Okay, so recovery basically is totally variable depending upon the actual individual. But as a general rule, we'll tell you, don't do anything too much that's going to get your heart rate or blood pressure up for the first 2 weeks. So don't lift, push, pull, carry anything heavier than about 10 to 15 pounds for 2 weeks. And I'll tell you that. We don't need to tell you that because you're not going to do it. So 2 weeks in terms of being very careful in terms of what you need to do. After 2 weeks, you can slowly start to increase your activity level at your tolerance. Okay, so what that means is that in general, however, most people don't get back to their normal activities for about 4 to 6 weeks. Okay, but after 2 weeks, you can slowly start to doing it. Now, in terms of picking up kids, yes, you can gently pick up your child depending upon how much they weigh. If you pick up your child or anything else, you have to do it properly, meaning you bend down, keep your back straight, grab your child or anything else you're picking up close into your body and stand up, use your legs to stand up, rather than bending over forward to use your core to do it.
But the main question people had is what happens if you get pregnant after? Would you recommend waiting or would you recommend
In a certain time frame?
So I do recommend waiting, not for the first year.
Okay.
And so after the first year, you're fine.
Right.
And if you get pregnant again, I mean, all we've done when we're taking out this extra skin and tightening with the muscles, we've put you back to normal,
right.
so to speak. So before, imagine you've never had the weight gain in the pregnancy, we've put you back to normal. Your body can still go through the normal transitions of pregnancy. You're still going to stretch out. Your skin's going to stretch. Your muscles are going to get stretched because we haven't done anything unusual.
Right.
So you certainly still can get pregnant. Not a problem. Will your skin stretch out again? Yes, absolutely. It'll stretch out again. Will it shrink again? No. That maybe not. Because again, I mean, it's just like if you're at a normal age and you get pregnant for the first time, will your skin shrink again after that? Some do, some don't. Similar situations such as this. You may feel a little tighter because, of course, we've tightened everything back up again. But pregnancy in and of itself is not a problem. But after the first year.
And then another question was about the belly button.
Yeah, you keep your belly button. Your belly button is your belly button.
Yeah.
But it looks significantly different now and afterwards because, of course, now you've got all this extra skin over the top.
Oh my gosh. A lot of people were asking, like, the criteria to get something like this in relation to, like, hitting your goal weight and maintaining for a certain amount of time. Do you have, like, a certain recommendation?
You should be at a plateau for about 6 months.
Okay.
And that's kind of optimal.
A lot of questions on price. That was probably the main question. Of course. And if there's payment plans and stuff like that.
Yeah, there is a price. I mean, the price is variable depending upon sort of what needs to be done and how much needs to be done.
So I would say a tummy tuck is usually like 11 or 12,000, and then a body lift, you could say like around 20.
Okay.
You have a fair amount of trauma.
Yeah.
I mean, we're reflecting a fair amount of trauma, and basically trauma is you're going to produce fluid. This swelling, this fluid that can accumulate underneath the skin. As I always say, it's kind of like fall down, twist your ankle gets big, right? Create fluid in response to that trauma. So yeah, this is a fair amount of trauma. So yes, you have drains going all the way around. There are some people where we do just tummy tucks, where you don't need drains because you're doing less, and certainly, especially in somebody such as yourself that doesn't have a lot of fat, where you don't need to do a lot of liposuction, you can theoretically get away without drains, but going all the way around, yes.
Okay.
Yeah.
And then the last question, this is just my question. Since I've had 2 C-sections and another surgery, is scar tissue like an issue when you're doing something like this? No?
No.
Okay.
No. It's exceedingly common that people have had C-sections or something else. So no, and I mean, in essence, we remove all of the scar tissue that's there, that's between the muscle and the skin. So with the C-section scars, wherever the C-section scar is, we always go below that so that we can remove that scar.
Okay.
So yeah, it's not a big issue. The inspiration that you can and do serve to other people that you will never meet is amazing. And again, I mean, in this life, what we can do is, we can go down our path and our journey in life to make ourselves better, but that's not necessarily the most important thing, I think.
Right.
It's to make ourselves better, to serve as a path and a guide for others.
Yes.
If other people can see you and they can look at you and you go, look where you've come and what you've done. If you can do that, I can do that.
Yeah.
That's an amazing thing.
Yeah.
It's an amazing gift to be able to give, to you, your family, your kids, to people you'll never meet. It's an amazing thing.
I just cannot stop smiling. I'm just so excited. Dr. Dry is just so amazing. He's so nice. He's so I don't know, he just made me feel so good and so excited. The whole staff was so nice. As soon as I walked in, they're so welcoming. They showed me around and everything, and that is where the place I got my consultation, that's where they do the surgery. It's a little private facility, and there's 2 surgery rooms. It's really comfortable. I'm so excited.